Welcome to our YouTube channel where we aim to educate you about all things acupuncture. I am Marika from Natural Solutions Acupuncture, and today we will give you some insights into the IVF process. So let's get started. If you've been wanting to start or grow a family, but it's not happening, you might want to go and see a fertility specialist to learn more about your options. Maybe you're already seeing one and you're feeling a bit overwhelmed after your consultation. Well, then keep listening. Let's explain the most common procedures that might be offered at your fertility clinic. It can be very overwhelming, so our goal with this video is to give you a better understanding of what your options are. When you have the first consultation with a specialist, the first starting point is often to get some blood tests and the sperm analysis done. Sometimes, if you've done all the tests recently with the GP, you may not need to redo all the tests. Let's first have a look at the most common terminology. ART stands for Assisted Reproductive Technology. This is the umbrella term for all fertility treatment, of which the most common one is IVF. Instead of going straight into IVF, some doctors recommend doing ovulation induction first. It is much less invasive compared to IVF, as there will be no surgery involved. How does this ovulation induction work? During the first week of your cycle, you'll be given a medication to promote the growth of your follicles. You'll be monitored closely by blood tests and/or ultrasounds to check the size and number of your follicles. Sometimes you'll be given an injection to help the release of the egg. Then you'll be advised when will be a good time to have intercourse. This is so-called timed intercourse. The next step after ovulation induction is often intrauterine insemination, or IUI. In this procedure, sperm is collected and being washed to obtain the best sperm. The sample will then be inseminated directly into your uterine cavity around your ovulation time. This can be done in a natural cycle where there is no medication involved, or a medicated cycle like we were talking about before. IUI is suitable for couples diagnosed with unexplained fertility, mild male factor fertility, couples that have not fallen pregnant with ovulation induction, or when frozen sperm or donor sperm is being used. And then there is IVF, in vitro fertilization, which basically means the fertilization takes place in a petri dish outside the body. This procedure involves collecting the egg and sperm and then putting them together in a lab. During your consultation, you'll be explained what medication you will need and when you need to take them. It involves daily injections into your lower abdomen. You'll be closely monitored with blood tests and ultrasounds to determine when the follicles are at the right size. Once you have some good sized follicles, you'll be asked to take a so-called trigger injection. This triggers the release of the eggs 36 to 40 hours after the shot. You and your partner will then need to go to the clinic together for egg and sperm collection. The eggs and sperm will be put together in a dish for fertilization, and the embryo can start growing. The embryo is left to grow for 5 days, and after this it will be transferred into your uterus. This is called embryo transfer. It is mostly done on day 5, but sometimes this is done on day 3. If there are any more embryos than the one transferred, they can be frozen for future use. After 10 to 14 days, you will do a blood test to see if you're pregnant. It is recommended not to use home pregnancy tests earlier than that, as the medication used during the cycle can give a false positive reading. There is also a long cycle version of IVF treatment. In this case, you will start your medications from 1 week after ovulation until your period comes, and then continue with daily injections before egg collections like above. This treatment can take 4 to 6 weeks and used to be done a lot, but it's used less often now. Okay, let's talk about ICSI. This means that instead of putting the egg and sperm together in a dish to let them fertilize naturally, a sperm is manually injected into the egg. ICSI is usually recommended if there are male fertility problems. You can also get your embryos tested before transfer. This is called PGT, pre-implantation genetic testing. The testing can take a few weeks, so you will need to wait for the next cycle for your transfer. The test is helpful to find chromosomal issues with the embryo so that only the healthy embryos will be used for transfer. PGT is recommended for women who have had several miscarriages or when either of the partners has known chromosomal issues. What about doing acupuncture when going through fertility treatment? Well, IVF treatment can be very overwhelming, and most women feel quite anxious during the process. Acupuncture is a great way of supporting yourself through this. It's a difficult time and you'll feel a lot more relaxed. Also with acupuncture, we will support the IVF process and are aiming to increase the blood flow to the uterus and the ovaries. Women are often commenting that having regular acupuncture sessions is keeping them sane during an anxiety-provoking time. I hope that answered some of your questions and gave you a bit of insight. Please like and follow us for more episodes on all things acupuncture. Remember, you are the master of your own health, and we can help you with that.